So in the interest of time, we'll move on. It gives me immense pleasure to invite our next speaker from Hyderabad Medical Complex, Dr. Yasir, and he's going to present his first case that they've done there and the program that they want to carry forward.
Bismillahirrahmanirrahim. My name is Yasir Hayat. I am Assistant Professor, Cardiology Department, Hyderabad Medical Complex, Peshawar. Extremely grateful to Pakistan Society of Interventional Cardiology for giving me an opportunity to represent my institution at this prestigious platform. My talk consists of two parts. In the first part, I will go through a case presentation, and my second part consists of update on stroke services at Hyderabad Medical Complex, Peshawar. So first, I will go through a case presentation. So this was a 36-year-old gentleman, morbidly obese, who had an aortic valve replacement in 2010. Immediately post EVR, patient developed complete heart block, for which permanent pacemaker was placed. And although he was taking warfarin, but he was non-compliant with monitoring of INR. In fact, his last INR was 1. He never consulted any cardiologist in between until he landed with complete heart block in February 2023, along with left-sided hemiplegia with power of 0/5, both in upper and lower limb. So his echo shows that there is normally functioning aortic valve and there was no obvious thrombus. So we passed TPM. This was his CT brain, which was done from outside, and although the pictures are not quite clear, but there is no visible intracranial bleed and there was no infarction. We calculated his aspect score and that turned out to be 7. We skipped one step of CT angiography because it was out of order, and therefore we directly went for cerebral angiogram and to try to save the time. So this is patient right-sided internal carotid artery, as you can see. This is right internal carotid artery, and it's perfectly normal but extremely tortuous. You can see a lot of bends there. And this is right MCA, which is totally occluded, leading to complete deprivation of blood supply in this whole area. So after discussion with the family, we went for mechanical thrombectomy. So the usual tower of power in mechanical thrombectomy consists of guiding catheter, which in this case is destination sheath 90 centimeter, which is not visible here, but this is intermediate catheter, which is Sophia Plus, along with Texas wire. We tried to cross the lesion, but there is extreme tortuosity. As you can see, there's a lot of bend here. And then ultimately we have to take a microcatheter to cross the lesion. And thankfully we succeeded in crossing the lesion. And this is a DOP technique, which is a direct aspiration first pass technique, where we extracted the clot. This is post-mechanical thrombectomy picture. This one, as you can see, there is TK3 flow along with good revascularization and a blush. You can compare that with pre-empty, pre-mechanical thrombectomy picture where there is no blood supply and there is good revascularization. The next day, less than 24-hour, patient power improved to 3/5, and the very next day, he was moving around. And this video is made with the permission of authorities and attendants. This is selection criteria that we use. Age more than 18 years, MRS of 0, pre-stroke NIHSS more than 6, aspect of more than 6, and there was large vessel occlusion.
Yes, sir, last 2 minutes, please.
Okay, sir.
Thank you.
So after confirming that, we proceeded with mechanical thrombectomy. Now, I will just quickly go through the second part of my presentation, which is update on stroke program at HMC. This is our stroke team. Our stroke team consists of interventional cardiologists, neurologists, and a radiologist. So our stroke program started a year back when we started selecting 2 of our specialist registrar, and later on these 2 specialist registrar were trained in RIC in stroke intervention, and later on these 2 specialist registrar were taken as assistant professor along with the specialist registrar. Our emergency unit consists of a triage nurse along with medical officers, and cardiology residents are there for stroke analysis. 2 of our stroke members are in the process of completion of XMINT, which is European stroke course in minimally invasive neurological therapy. This is our cardiology building, and it has undergone through a lot of changes. The latest being dedicated stroke unit, stroke cath lab, and stroke OPD. This is our stroke ICU, which is 8-bedded, equipped with ventilator support and monitoring facility. Our Philips cath lab is equipped with single plane system, but we are trying to get a biplane system in the future. Our neurology department is full-fledged unit with assistant professor, specialist registrar, and medical officers. And they have started administering IV TPAs for a couple of months. So far, neurology department has administered 16 TPAs, and we have performed 4 cerebral angiogram and a mechanical thrombectomy. The reason for less number of cases is because of logistic issues and problem with import of inventories. This is our WhatsApp group which has created where we share CT scan brain, triage form, CT angiogram, and consent form. There are a lot of people who has contributed. There are a lot of people who has contributed in our stroke program, but the main person behind stroke program is Professor Zaid Aslam Awan. He is our head of cardiology department. He is one of the pioneer of cardiac services at Hyderabad Medical Complex. He has established EP department, cardiac surgery department, peripheral services, and the latest being stroke unit. And in addition to this, he is doing a lot of humanitarian work. It would be very unfair if I don't mention Dr. Asim Javed. He's the backbone of our stroke program. Not only he trained our faculty, but he trained our cath techs, staff nurses. In addition to that, he arranged a lot of workshops before starting stroke program. And he is still available round the clock for remote proctoring. So sir, we are very thankful to you. This is our stroke team. Dr. Mohammad Asghar Khan, which is our chairman cardiology department. And then me, myself, Dr. Mohammad Niaz Khan, Dr. Abid, specialist registrar. And with this, I would like to thank my kids are also thanking you. Thank you so much.
Thank you very much, Dr. Yasir.